So another very common cause of pain that we see every day with people with shoulder issues is a frozen shoulder. And what a frozen shoulder is essentially is scarring around your shoulder joint that typically gets caused by some form of tendonitis. A lot of times it's idiopathic, meaning we don't know why it happened. It just happened. You started getting pain in the shoulder, and the body's general response in that setting is to have you move the shoulder less, which causes you to get stiff. And typically when a joint is stiff in our bodies, it doesn't function and move the way that it should, which then causes more pain, more stiffness. And you get in this cycle of stiffness and pain, stiffness and pain. And often I see people after this has been going on for several months and they can hardly lift their arm above their shoulder. Now, frozen shoulder can be very painful. It can be very detrimental to your function. But the good news is typically with an injection of some anti-inflammatory medicine and a disciplined stretching program, you can get all the motion back in your shoulder and have very little pain without having an operation. 90 to 95% of people don't end up having surgery for this, and I would say in my practice it's even higher. I'd say probably closer to 98 or 99%. One thing that we do in the office is I always check with an ultrasound machine to make sure you don't have a tear in your rotator cuff, and that's not what's causing it. The good news is the majority of the time it's not torn, and really it's just caused by scarring and a contracture of the capsule around your shoulder. And by undergoing a disciplined stretching program where you stretch every single day, the vast majority of patients can get better without having surgery. It can just take quite a while. Sometimes 6 weeks, more often 3 months, and sometimes even 6 months or longer to get all your motion back. But typically everybody gets their motion back and they do well.